Good morning, Miss Vidya. We are from Group 5. Today, we would like to present our presentations about the parathyroid glands. Before we start our presentations, I would like to introduce my group members. I'm Venice.
I'm Ashley.
I'm Singwei.
I'm Jessie.
I'm Fahim.
I'm Kanan.
I'm Rani.
I'm Yiling. So today I'll be talking about the parathyroid glands. These are four small pea-sized endocrine glands located just behind the thyroid glands, which consist of two pairs with one positioned superiorly and the other inferiorly. Their main role is to regulate calcium and phosphate levels in our body by secreting the parathyroid hormone, which is also known as PTH. This hormone is crucial for nerve function, muscle contraction, and bone remodeling. When PTH levels become imbalanced, it can lead to conditions such as hyperparathyroidism or hypoparathyroidism. Now, let's dive deeper into their functions and importance.
Now, I'll talk about the structures of parathyroid glands. So, in our neck, the thyroid glands are located at the posterior surface that consists of four small-sized and oval shapes of the parathyroid glands. Okay, so the parathyroid glands is 30 to 60 milligrams in weight and also 3 to 6 millimeters in length, as you can see from these pictures. Okay. So each of the parathyroid glands is enclosed in a thin fibrous capsules, and this thin fibrous capsules is a protective layer of the parathyroid glands. So the centers in the parathyroid glands extends into the glands and it's divided into tiny loops, as you can see from the pictures. And what are the functions of the capsules? So this capsule separates the parathyroid glands away from the thyroid tissues and it maintains structural integrity. So moreover, capsules also supports effective gland functions. So this is the capsules pictures. Okay, now I'll talk about the histologics of parathyroid glands. So the parathyroid glands are made out of special cells under microscopic levels, and the main types of cells are made up the glands parenchyma or functional tissues are chip cells and ossifid cells, as you can see from these pictures. Okay, now first of all, I'll talk about the chip cells. So, chip cells are very functional cells in the parathyroid glands, and the structures of the chip cells is small, polygonals, and nucleus in the middle of the parathyroid glands. And what are the functions? So, the chip cells are most common cell types in parathyroid glands, and it's also producing and secreting parathyroid hormones PTH, which is these functions of the parathyroid hormones will be talked about by my friends Jessie. Okay, next is ossifid cells. So the structures of the ossifid cells are larger or bigger than the chip cells, and also it's less frequently seen under the microscopics. Okay, so ossifid cells contains of eosinophilic pink, which is cytoplasm, which due to high concentrations of mitochondrial contents, and the ossifid cells are poor in developed rough endoplasmic reticulums and have small Golgi apparatus and fields of secretory granules. So, what are the functions of ossifid cells? So, ossifid cells do not actively synthesize parathyroid hormones, which the previous slides I mentioned that is poor in developed in rough endoplasmic reticulums and other organelles. And ossifid cells actually are the ossifid cells functions are actually unclear in the websites, but in studies suggest that these parathyroid glands ossifid cells is increased in response to pleural stimulations, and also in findings of these websites they say that also have some metabolic activities and could play a role in certain disorder affecting these parathyroid glands. That's all from me. I'll pass it to my friends. Thank you.
Now we move on to function of parathyroid. First, the parathyroid gland will release the parathyroid hormone, PTH. It will regulate the calcium level in blood. as we know, the calcium is very important in our body. So if our body have a little bit decrease the calcium, so body will show some signs and symptoms to show that the muscle and nerve have problem. But actually at the same time, if the calcium decrease until the body actually is not enough, we'll have the health problem issue. So just now got mentioned that the parathyroid hormone is released from the parathyroid gland. Parathyroid hormone will function in 3 parts of our body. There's bone, kidney, and also small intestine. So we look at the bone first. When our blood calcium decrease, they will stimulate the osteoclast and also the bone to release the calcium in our bloodstream. And also if it release the PTH too much, it will cause our body have weakened bones and also the increased risk of fracture. Now we move on to the kidney. So as we know that kidney is more important for regulate the calcium balance. So because it can increase the calcium absorption and also reduce the calcium excretion and prevent the calcium loss in urine. At the same time, also can regulate the phosphate level and excrete and promote the phosphate excretion. Okay, now it's small intestine. Okay, in small intestine, it will stimulate the production of parathyroid and also the form of vitamin D because it can improve the calcium absorption. So in this all process can see that PTH can increase the calcium stored in body and also prevent some conditions like hypocalcemia, muscle cramping, and also abdominal heartbeat and seizures. Overall, we can know that the parathyroid hormone is very important. It's because our body has a bit decrease, will have muscle and nerve problem. And also we can see that if our body is not enough the calcium, we have serious health issue. That's all my part. So now I'll pass to my friend. Thank you.
Okay, today I'll be presenting for the regulation of parathyroid hormone secretions. As we all know that calcium is important for our strong bones, but do you all know that without PTH, our body won't be able to regulate calcium properly? So imagine what will happen if our calcium levels become too low or too high. These kind of conditions will lead to weak bones, kidney stones, muscle spasm, or even some life-threatening conditions. So now we will look into how parathyroid glands help to maintain our calcium balance and keep our body to function smoothly. Okay, so PTH is an important hormone which is secreted by the parathyroid glands, the parathyroid glands is located behind the thyroid, and parathyroid glands consist of 4 small glands. So although they are very small, but they play an important role in regulating the calcium levels. So the PTH primarily acts on 3 major target organs and tissues to maintain the calcium balance. The first one is the bones, where the calcium is stored in large amounts. And then the second one is kidneys, which will filter and reabsorb the calcium. And then the third one is small intestines, where calcium is absorbed from food. So now we will look into deeper a bit how parathyroid hormones is regulated to ensure the calcium homeostasis. Okay, so how parathyroid hormones is controlled directly by the calcium levels. The PTH secretions is affected by the negative feedback mechanism, so meaning that it is regulated in response to calcium levels in the blood. And in this part, the calcium sensing receptor, which is also known as the CASR, plays an important role in this, as it will help to detect the calcium level in the blood. And then this receptor acts like a calcium monitor to ensure the PTH is released only when it is necessary. So when it detects that the blood calcium is low, which is also known as hypocalcemia, it will lead to more PTH hormone to be released. So the CASR will detect that the calcium level is low, and it will send signals to the parathyroid glands to secrete more PTH hormones. And this increases the calcium levels by releasing the calcium from bones. It is also called bone resorption, and also increasing calcium reabsorption in the kidneys. And the third one is also enhancing calcium absorption in the intestines. So when it comes to high blood calcium, which is also known as hypocalcemia, this will lead to less PTH to be released. So the CASR will also detect that the calcium level is high, and then it will also send signals to the parathyroid glands to reduce the PTH secretions. So as a result, bone resorption will decrease, calcium excretion will increase through the urine output, and then also in the intestine, less calcium will be absorbed. So in conclusion, this negative feedback system ensures that calcium levels stay within the normal range, and also prevent excessive calcium loss and also build up. Thank you.
Okay, so now I'm going to talk about secondary regulations of PTH. There are three things that obtained in secondary PTH. First is the active form of vitamin D, which is calcitrol-125-dehydroxy vitamin D3. The next one is phosphate and magnesium. Okay, let's talk about the first one, vitamin D. The active form of vitamin D is calcitrol-125-dehydroxy vitamin D3. The vitamin D is mostly obtained from sunlight, foods, which is oily fish that is full in omega-3 fatty acids, supplements. Okay, let's talk about how vitamin D increase calcium absorption from intestines to increase blood calcium levels. So, when the calcium is high, vitamin D will inhibit the production of PTH through negative feedback system, which means when the calcium level in our blood is high, the vitamin D would slow down the production of PTH. So, next one is phosphate. When the phosphate levels are high, the PTH would also increases to reduce the calcium levels through calcium phosphate binding. So, when the phosphate levels are low, there are more free calcium in our blood, which would slow down the PTH secretion. Okay, there are cases like chronic kidney diseases, which would have excess phosphate retentions, would causes continuous PTH secretion, causes secondary hyperparathyroidism and bone abnormalities. We know osteodystrophy, which is these photos below. Okay. Last one is magnesium. Mild hypomagnesemia, which is low magnesium level, would causes PTH to increases. So individuals have conditions like chronic alcoholism, malnutrition, diarrhea, which is severe magnesium deficiency, which leads to hypocalcemia and damaged PTH. So deficiency of magnesium, which causes hypoparathyroidism-like symptoms due to abnormal CASR functions and inhibits PTH release. So as we talk about low magnesium levels would increase the PTH secretion, then high magnesium levels would decrease the PTH levels. So there are some signs and symptoms that magnesium deficiency affects the bodies: headaches, migraines, fatigues, anxiety or depressions, constipation, loss of appetite, muscle crampings, and restless leg syndrome.
Okay, so let's talk about hyperparathyroidism. Hyperparathyroidism is a condition where the parathyroid gland producing too much of parathyroid hormone, as you can say, the overactive parathyroid glands, meaning that the parathyroid glands are working too much, making more parathyroid hormone than the body actually needs. So for an example, when the parathyroid glands are working too much to pull calcium from bones or to stop the kidney from getting rid of it, this leads to too much of calcium in the blood, as you can say, hypercalcemia. So in this picture, these are the normal, this is the parathyroid glands, and this is the hyperparathyroid glands. So we will talk about the types of hyperparathyroidism. There are three main types of hyperparathyroidism: the primary, the secondary, and the tertiary. So we will talk about the primary first. So for primary hyperparathyroidism, it's the most common problem. As you can see, it occurs when one or more parathyroid glands become overactive, often due to a benign tumor. So, benign tumor means like there's a lump in your body that is not cancer. It doesn't spread or grow, it just stays in one place that can cause lots of problems if it's pushed on the other part of the body. So, once again, primary hyperparathyroidism due to a benign tumor, we call it adenoma. In addition, this causes high calcium level known as hypocalcemia. Alright, next time we will talk about the secondary hyperparathyroidism. They occurs due to low calcium levels, often from kidney disease. So basically, when the parathyroid glands become overactive in response to low calcium levels in the blood, which causes from kidney disease, then the parathyroid glands will try to fix it by producing extra hormone. Alright? Lastly, we will talk about the tertiary hyperparathyroidism. This hyperparathyroidism happens after the secondary hyperparathyroidism has been around for a long time. Therefore, as you can see, the parathyroid glands produce too much of parathyroid hormone on their own without responding to the normal signal from the body. Therefore, the treatments it usually depends on how severe the condition is, but most commonly to treat these types of hyperparathyroidism is surgical removal of the overactive parathyroid glands, because it is much more curative treatment. But however, if the surgery is not the option, doctor may provide some prescribed medication to improve their calcium level. Plus, the doctor has to monitor the calcium levels and symptoms over time. So treatment should always be personalized, so it's important to consult with the healthcare provider who can offer the best option based on the specific circumstances of the patient. Next up, hyperparathyroidism can cause a wide range of symptoms. Remember them as stone, bones, and growths. So in stone part, consists of kidney stone, dehydration, excessive urination, and for bone pain, fractures, osteoporosis, and for growth, stomach pain, nausea, and constipation. So, for example, if someone came in with osteoporosis, one of the major complications of hyperparathyroidism, normally parathyroid hormone regulates calcium levels, right? But if too much of parathyroid hormones tell the bones to release calcium in blood, then this will cause osteoclast, which is a bone-breaking cells to break down bone too fast. Then the bone will become more weak and most likely to be fractured as calcium being removed. Because osteoporosis often has no symptoms until like a fracture will occur. So maybe we should be thinking, could this be hyperparathyroidism? But there's ways to confirm if it's hyperparathyroidism by blood tests to check if it's high calcium, or DEXA bone scan to check if there's osteoporosis, or kidney ultrasound to check for kidney stones in this part. So that's all from me. I'll pass it to my friend.
So now I will be talking about hypoparathyroidism. Hypoparathyroidism is a condition where the parathyroid glands produce low levels of PTH. PTH, also known as parathyroid hormone. Parathyroidism is much more rarer than hypoparathyroidism because it has less known cases and there is affecting only a few people worldwide. So now I will be talking about the types of hypoparathyroidism. There are many types of hypoparathyroidism, but these are the most known types. First, we have acquired hypoparathyroidism. It is when this is the most common type of hypo, and it is caused by surgical removal or the accidental damage during surgery to the parathyroid glands during neck or thyroid cancer surgeries. Next, we have autoimmune hypoparathyroidism. It is caused by the immune system accidentally attacking the parathyroid glands and also removing the PTH. Next, we have congenital hypoparathyroidism. It is caused by genetic mutations affecting the parathyroid gland to develop more or function. It is often diagnosed in infants with low calcium levels shortly after birth. So these are the signs and symptoms of the hypoparathyroid gland. Hypoparathyroidism. it has tingling numbness in hands, feet, or lips, muscle cramps, muscle spasms, also known as tetany, and also fatigue. So there are many ways to treat hypoparathyroidism, one of which is eating or consuming vitamin D through orally, by chewables, liquid, or also pills, because this will help our parathyroid glands to function properly. Other than that, if the case is too severe, they can also take vitamin D through intravenously. Okay, that is all from me.
Now I'll be presenting about what to do if you suspect you have hyperparathyroidism or hypoparathyroidism. First, you can seek a doctor, preferably an endocrinologist for an evaluation. Secondly, you can get a blood test. This is to check for any abnormalities in calcium, parathyroid hormone, phosphorus, and vitamin D levels. Next, you can undergo additional tests. These tests include urine calcium tests, blood density scans, or imaging, which includes ultrasound, CT scan, or MRI to assess the parathyroid gland. There is also medication used to treat hypoparathyroidism, which includes calcium mimetic, bisophosphates, vitamin D analogs. While for hypoparathyroidism, there's also medication which includes calcium supplements, vitamin D supplements, magnesium supplements, and thiazide diuretics. In conclusion, parathyroid glands are 4 endocrine glands located behind the thyroid glands in the neck. They include Chi cells which produce parathyroid hormones to regulate calcium homeostasis by inhibiting osteoblasts and controlling calcium levels. PTH secretion is influenced by blood calcium levels, vitamin D levels, phosphate levels, and magnesium levels. While low calcium stimulates parathyroid hormones release, calcium nitrite suppresses it. There's also 2 complications related to parathyroid glands, which includes hyperparathyroid and hypoparathyroidism. Hypoparathyroidism results from excessive parathyroid hormones causing hypercalcemia. It has 3 types. Primary, due to benign tumors in the parathyroid glands. Secondary, due to chronic kidney diseases or autoimmune disorders. Tertiary, due to secondary hypoparathyroidism, which remains untreated for a long period of time. While for hypoparathyroidism, it's due to low parathyroid hormones production. This is due to chronic kidney diseases, autoimmune disorders, thyroid surgery, cognitive defects, and magnesium deficiency.
That's all from us. Thank you!